let's begin our half hour here at 5:30 with you. Time for our top talker. May is Mental Health Awareness Month, and today we're focusing on teens' mental health because, as we know, so many of them have been affected by the world events of the last year.
It's been hard for a lot of folks, but teens, their entire lives were upended. Well, a recent Children's Health poll shows nearly 50% of teenagers suffered from mental health issues during the pandemic.
So in his latest Doing Double Duty segment, our Matt Wintz talked to a local psychologist on how to recognize problems in our young people and what we can do to help.
Now more than ever, establishing good communication patterns with our teens is really important.
Isolation, being cut off from peers, remote learning. All of these have had a drastic influence on socialization, and although Ohio is lifting health orders, some of these problems over the last 15 months may have an everlasting imprint on social interactions.
We're just beginning to understand the extended impact.
A new poll by CS Mott Children's Hospital gathered responses from 977 parents with teens that were between the ages of 13 and 18. 3 out of 4 parents say COVID has had a negative impact on their teens' ability to interact with their friends, and nearly half of the parents say they've noticed new or worsening mental health conditions in their teens. So what can parents try to do to help? Dr. Amy Lee, a pediatric psychologist at Cleveland Clinic's Children's Center for Pediatric Behavioral Health, says begin really making an effort to just talk to them.
First, just make an observation, like, hey, I've noticed you've been in your room a lot lately. Or you seem kind of quiet at dinner. I've tried to ask you how your day is, and I've noticed that, you don't have a lot to say. So just an observation about anything.
Many parents have already started to relax the rules, like allowing them more time with friends outside of social media, and 81% of those parents say it's helped.
Check in that way often with teens so that they know parents are interested in how they're doing, what they're thinking, how they're feeling. Kids may not have a lot to say every time, but it's important to kind of keep the door open.
So what you're saying in terms of that, and this is just from my daddy notes when they're a little bit older, but even if they don't say anything the first time, just by merely asking them or telling them that you're noticing them, that plants a seed where maybe next time they'll answer or talk.
Yes, and even for young kids.
And parents, that sometimes getting your kids to talk and actually engage, it can be pretty difficult. And they might have some struggles getting back to normal.
Kids may be not as gung-ho, right? We were all on autopilot prior to this pandemic. The brakes came on, and it's kind of like, okay, well, let's reassess what kind of a lifestyle do we want, and kids are no different.
What do you see in your practices that kids need most right now? Is it that social interaction? Is it structure? Is it a return to what they were doing before? What is it?
Yes, all of the above. There have been a lot of ways that kids have been disrupted.
Remember, teens are still growing, both physically and mentally, and you don't have to recognize that all these changes are negative.
The impacts are potentially going to be, I don't think we know for sure, but going to have a positive side. Be patient, take it slow. The goal should be really let's just see what it feels like to be around people again.
And guys, Dr. Lee also adds that she thinks a gradual reentry is going to be the biggest problem going forward and the biggest challenge for parents. That's due to the fact that demands outside the home are really going to start to ramp up for the kids, and it's going to put them in this psychological and emotional kind of out of shape place that they haven't been on. So if you're looking for help for your teens' mental health, we've posted several links online at wkyc.com/what's new.